Science has been humanity's torchbearer, illuminating truths and advancing progress. Yet some experiments have plunged into moral darkness, sacrificing lives, dignity, and trust for knowledge or power. The 10 studies below, spanning centuries and continents, crossed ethical boundaries so profoundly they reshaped how we govern. Research, from Nazi death camps to Cold War labs and beyond, these forbidden experiments exposed the perils of unchecked ambition. Their horrors birthed ethical frameworks like the Nuremberg Code and informed consent laws, ensuring science serves humanity, not its destruction. These cautionary tales, etched in suffering, urge vigilance as technology pushes new frontiers. 1. Nazi concentration camp experiments, 1940s Germany. In the 1940s, Nazi doctors like Josef Mengele, dubbed the Angel of Death, turned concentration camps into grotesque laboratories at Auschwitz, and how prisoners, Jews, Romani, disabled individuals, and political dissidents faced unimaginable horrors. Submerged in ice water to study hypothermia, locked in low-pressure chambers to simulate high-altitude crashes, or subjected to sterilization surgeries and poisoned injections. Mengele's twin experiments sought genetic insights, often killing one twin to dissect both. Thousands perished or endured lifelong trauma. The 1947 Nuremberg trials exposed these atrocities, leading to the Nuremberg Code, which mandated voluntary consent and banned harm and research. These experiments remain a stark warning of science's potential for evil when morality is abandoned. 2. Unit 731 Biowarfare Program, 1930s-1945, Japan. Japan's Unit 731, based in occupied China's Pengfang district, was a clandestine biowarfare program led by microbiologist Shiro Ishii from the 1930s to 1945. Scientists performed vivisection without anesthesia, infected prisoners with plague, cholera, and anthrax, and exposed them to frostbite, mustard gas, and radiation to develop biological weapons. Entire villages were bombed with plague-carrying fleas, killing thousands. An estimated 200,000 Chinese civilians and prisoners died after Japan's surrender. The U.S. granted immunity to Unit 731 leaders for their data, suppressing the truth until the 1980s. This cover-up delayed global bans on biological weapons and exposed the ethical peril of trading justice for strategic gain, haunting international law. 3. Tuskegee Syphilis Study, 1932. In 1972, USA, in Macon County, Alabama, the U.S. Public Health Service launched a study in 1932 targeting 600 black men, mostly poor sharecroppers, promised free health care. They were never told they had syphilis, nor treated, even after penicillin became the standard cure in the 1940s. Researchers watched as the disease ravaged bodies, blinded and killed, infecting spouses and children. In 1972, whistleblower Peter Buxton exposed the study, sparking public fury. By then, 128 participants had died, and 40 wives and 19 children were infected. The 1974 National Research Act, requiring informed consent and review boards, was a direct result addressing systemic racism in research and rebuilding trust in medical ethics. 4. Project MK Ultra, 1950s, 1970s. USA. Fueled by Cold War fears of Soviet brainwashing, the CIA's MK Ultra program, launched in 1953, sought to master mind control. Unwitting subjects, civilians, soldiers, prisoners, even mental patients, were dosed with LSD, subjected to sensory deprivation, hypnosis, or electroshock, torture. Experiments occurred in secret facilities, universities, and hospitals across the US and Canada. Frank Olson, a scientist, died in a suspicious fall after being drugged. Exposed in 1975 by the Church Committee, MK Ultra's violations of autonomy led to executive orders curbing government experiments. Its legacy fuels distrust in institutions and informs debates on psychological ethics and informed consent. 5. The Monster Study, 1939, USA. In 1939, University of Iowa psychologist Wendell Johnson tested whether negative feedback could induce stuttering. 22 orphans, unaware of the study's purpose, were divided. Half received praise for their speech, half were berated as stutters, even if they spoke fluently. The criticized group developed speech impediments and lasting emotional trauma, with some withdrawing socially. Nicknamed the Monster Study for its cruelty, its findings were suppressed for decades to protect Johnson's reputation, emphasizing the harm of psychological manipulation and research, and the need for oversight. 6. Harlow's Isolation and Pit of Despair Experiments, 1950s-1960s, USA. At the University of Wisconsin, psychologist Harry Harlow studied love by isolating baby rhesus monkeys. Separated from mothers, they were raised with wire or cloth surrogates, or confined in the pit of despair, dark, steel chambers, for up to a year. The monkeys emerged with severe psychological damage, unable to socialize or parent. Harlow's work proved maternal bonding is important, but drew condemnation for its cruelty. Public outrage fueled the animal rights movement, leading to 1985 amendments to the Animal Welfare Act, banning undue harm in research and reshaping ethical standards for animal studies. 7. Milgram Obedience Experiment, 1961, USA. In 1961, Yale psychologist Stanley Milgram conducted a landmark experiment to explore obedience to authority in the wake of atrocities committed during the Holocaust. Volunteers were led to believe they were part of a memory study and were instructed to administer electric shocks to a learner, actually an actor, for each incorrect answer. Under the prodding of an authoritative experimenter, participants increased the voltage, with some going all the way to the maximum, 450 volts. Despite the learner's apparent screams and pleas, the experiment sparked global debate, revealing troubling truths about obedience, but also raising serious ethical concerns. It directly influenced research ethics, emphasizing informed consent, full debriefing, and protection from psychological harm. 8. Stanford Prison Experiment, 1971, USA. Philip Zimbardo, 1971, Stanford Prison Experiment remains one of psychology's most infamous studies. Conducted in a Stanford University basement, transformed into a simulated prison, the experiment involved 24 male college students randomly assigned to roles of guards or prisoners, intended to last 2 weeks. The study descended into chaos within just 36 hours. Guards quickly adopted authoritarian behaviors, subjecting prisoners to psychological abuse, humiliation, and arbitrary punishments. Some prisoners suffered emotional breakdowns, with several pleading to be released. The fallout shaped stricter ethical guidelines and Institution Review Board (IRB) protocols in psychological research. 9. Literacy drug trials, 1957-1961, Europe. Developed by the German pharmaceutical company CME Group, menthol was introduced in the late 1950s as a sedative and treatment for morning sickness in pregnant women. Despite minimal clinical testing, it was rapidly marketed across Europe, Australia, and Canada. By 1961, horrifying consequences emerged. More than 10,000 babies were born with severe birth defects, most notably Folk, commonly a condition where limbs are drastically shortened or absent. In the United States, disaster was largely averted thanks to FDA reviewer Dr. Francis Kelsey, who insisted on further testing before approval. The tragedy exposed serious flaws in drug approval processes and prompted global outrage. It directly led to the 1962 Kefauver-Harris Amendment in the U.S., which enforced stricter regulations for drug safety and efficacy. Thalidomide's legacy reshaped global pharmaceutical standards, emphasize informed consent and rigorous clinical trials. 10. Soviet Dead Hand Nuclear Doomsday System. 1980s Soviet Union. During the Cold War, the Soviet Union allegedly developed a chilling defense mechanism known as Dead Hand, or Perimeter, an automated nuclear weapon system designed to guarantee retaliation even if the nation's leadership was completely wiped out in a first strike. If key sensors detected nuclear detonations and loss of command communication, the system could automatically launch a devastating counterattack, ensuring mutual destruction, though shrouded in secrecy. Partially declassified documents have confirmed aspects of its existence. It also sparked international debate during arms control negotiations, illustrating the grave risks of removing human judgment from life or death. Military decisions in the nuclear age. The ethical reckoning these 10 experiments, from Nazi labs to Soviet bunkers, share a haunting legacy: the betrayal of human dignity for knowledge, power, or ideology. Nazi in Unit 731. Atrocities expose science's capacity for evil. Tuskegee and Cairo Ultra shattered trust in institutions. The Monster Study and Harlow's work exploited the defenseless. Milgram and Stanford revealed our susceptibility to cruelty, while thalidomide and Dead Hand underscored the risks of haste and automation. Each triggered reforms. The Nuremberg Code informed consent laws, animal welfare rules, drug safety protocols that protect against future abuses. Yet, as biotechnology, AI, and autonomous systems advance, these nightmares demand vigilance. The suffering they caused, paid in blood, trauma, and trust, teaches that science without ethics risks humanity's soul. These lessons, hard-won, must guide the future, ensuring knowledge uplifts rather than destroys.